I'll go over the sex in later life. Okay, a recent study was published in JAMA that involved over 3,000 participants ages 57 to 85 on sexuality, and basically what it revealed is that Americans' lives suggest a previously uncharacterized vitality and interest in sexuality that carries well into advanced age, which perhaps has not been appreciated as an important part of life. That's a quote from someone from the director of the study. So the study found that many older adults are sexually active, but about half of the men and women surveyed reported at least one sexual problem, and about a third report at least 2 problems. And just to run by the specific problems, because this just came out, so I just have the real general information. In general, older adults are sexually active. Healthier people are more likely to report being sexually active. And about half of sexually active older adults report at least one bothersome sexual problem. Erectile problems or vaginal dryness are the common ones. And most older adults have not discussed sex with their doctors. Despite the high prevalence of sexual problems, only 38% of men and 22% of women said they had discussed sex with a physician since age 50. And so maybe that's also the cohort effect, you know, where it's a person might not be comfortable discussing this with their doctor. Or maybe a lot of people wouldn't, I'm not sure. Yeah, and the thing, you know, we have this cultural thing that we only see, like on TV or movies, sex is only with people who are attractive and young, right? Like, you know, older, it just doesn't happen, or, you know. So, and there's the stigma or the stereotype that older men who are interested in sex are dirty old men. You know, it's really a shame that here we are living in these bodies that are sexual, and we can remain sexual throughout our life, and it's an important way of being affectionate and feeling close to someone, and so it's an important part of being human. So it makes sense when you think about it that it would be of interest in later life. But there are problems finding a partner, the health problems. So here are some myths that the elderly are asexual. Just a point is, generally speaking, that if a person was active earlier in their life, they'll be active sexually later in life if there aren't health problems and if they have a partner. And you need a certain amount of energy for intercourse, so you have to be in somewhat okay health. Arthritis and back ailments can get in the way. I put this piece in on sexually transmitted diseases, and they did look at this in the study. And it is an issue to some degree. I'm not sure I think that with this new study that came out, we're going to have new numbers on this as far as the incidence of AIDS, I think, is a bit higher from what I remember reading. And just to keep in mind that this group of people may likely never have had sex education, and so how to speak to them sensitively about these issues and recognize that perhaps they never have they haven't learned much about it, and they won't be embarrassed to ask, possibly. And the reason I included this is because I had a social worker in the class who brought up the fact that she had a patient who did acquire HIV, or patient who acquired HIV, and he was a widower, and after his wife died, maybe he went to prostitutes, but anyway, he was, you know, wanting contact, and he acquired HIV, and it seemed to be a situation where he was not very informed. And another little quick story is, I have a patient who's in her mid-30s, And her father is late 60s maybe, and his wife died, her mother, and he's dating a woman, and somehow the patient found out that this woman he's dating is taking a cyclovir, which is for herpes or shingles, and so now my patient's fearful that this woman's going to give her father herpes, and so there's this family discussion with the children. Who's going to have the talk with Dad about safe sex? And then so she told her brother that, you know, her brother should talk to him, and her brother said, that's not my business, I'm not talking to him. And so she decided that she has to do this soon, because he's naive. So I think I mentioned the male menopause, which, does it exist? I don't think so, because it's not the same as women have a definite drop in estrogen, you know, that is very defined, whereas for men, they can father children into their 80s. So, but it's become a popular kind of notion, I think, because of testosterone replacement, the patch. But testosterone is a really important hormone for men. It's responsible for erections, muscle mass, hair growth, libido, sperm production, even red blood cell production. And then in adolescence, it's because of testosterone that the voice deepens, because the vocal cords thicken. So it is an important thing to test for if a man is low. So for men, erectile problems are the biggest problem for older men. So it's pretty high percentage of some problem, partial or complete, between the ages 40 and 70. And as they get older, it becomes more of a problem. But now there's Viagra that can work to some degree. And if you think of the penis as an artery that you know, has to have a sufficient blood supply to have an erection, then that's kind of a basic understanding of you know, we can understand why problems with circulation can cause erectile problems if you think of the penis as an artery. So if a man's taking medication or has hypertension or diabetes, anything that will affect the blood supply, circulation, or the nerves can affect erectile functioning. And then for women, menopause, there are some good aspects and some negative aspects. No need for birth control. Some women, you know, report feeling freer and appreciate that. And but then there's the problems. The vaginal dryness is the most distressing. But there are available lubricants, and also body image problems or changes, I guess. But generally speaking, there are kind of gradual changes, mild changes that occur sexually with aging. I'm trying to think of how to kind of summarize this. One thing I did have in my notes that I wanted to mention that I think is one of those things that people feel uncomfortable with and are afraid to ask about, and that is being able to have sexual intercourse or being sexually active after having a heart attack, because there's this belief that by some people that, you know, they'll die if they have sex after a heart attack. And I don't know if cardiologists talk to their patients about this or not, but because if a man can walk 2 to 3 flights of stairs, then they're able to perform sex. It's mild to moderate exercise. It's not as strenuous as maybe people think. So, yeah, I think that that's an important. I want to somehow wrap this up. It's kind of similar for men and women. Decreased blood flow to the penis, to the vaginal area, loss of elasticity, less sensitivity in the penis. And as far as libido, it decreases over time, slower arousal for women. And it's still possible to have an orgasm. It just might be delayed or not as frequent, less intense for women. There may be some pain, uterine pain. For men, there's a smaller volume of semen, less forceful ejaculation, less intense orgasm, and it takes longer to reach orgasm. And then for resolution, the body returns more rapidly to an unaroused state for both, and more time needed between erections.